Now, treatment need indices. The main example of these indices is the Index of Orthodontic Treatment Need, or IOTN. Index of Orthodontic Treatment Need is used to rank malocclusions in terms of various occlusal features and perceived aesthetic impairment. This index is used in UK in order to identify individuals who receive the greatest benefit from orthodontic treatment, and therefore they can be treated freely in the general hospitals. This index is composed of two components. These are the dental health component and the aesthetic component. Dental health component. The dental health component records the worst occlusal feature of the malocclusion for each individual who comes for treatment. It used a dental cast with a specially designed ruler. A hierarchical scale is used to identify the worst feature, and these features are missing teeth, overjet, crossbite, displacement of contact points, and overbite. The acronym MOCTO is used to identify these features. And according to these features, each case can be graded into one of 5 grades, from grade 1 to grade 5. In grade 1, there is no need for treatment. If the case received grade 2, there is a little need for treatment. Grade 3 means there is a moderate need for treatment. Grade 4, great need for treatment. And if the case received grade 5, that means there is a very great need for treatment. So, according to study model and a special ruler, we can identify these occlusal features. And according to these features, each individual can receive one of these grades in order to identify who will need treatment. This is the specially designed ruler, and it can be used to measure the occlusal features on a study model. This table is used to describe the 5 occlusal features of the dental health component. You can see there is a priority for grade 4 and grade 5 because there is a great and very great need for treatment according to these grades. So, when the patient comes for diagnosis, we can start with the missing teeth. So if the patient has missing teeth, that means he or she will receive grade 4 or grade 5. If there is no missing teeth, we can go to the overjet and see in which grade we can classify the patient. And if there is no problem with the overjet, we can go to the next, which is a crossbite, and see which grade can be received, and so on. So this classification or these grades can be used to describe the priority of treatment. Grade 4 and grade 5 are the highest priority for treatment. The other component of the IOTN is the aesthetic component. It consists of 10 color photographs. that showing different levels of dental attractiveness. You can see from score 1 to score 10. The patient is asked to close the front teeth together, and the examiner compares the appearance of the patient's teeth with the visual 1 to 10 scale. Sometimes the patients or the parents are also asked to choose a photograph which is most closely representing their own dental appearance, and to give a score according to this scale. In this scale we have different grades also. If the patient has score 1 or 2, that means there is no need for treatment. If the patient has score 3 or 4, there is slight need for treatment. Patients with score 5 to 7, there is moderate or borderline need for treatment, while score 8, 9, and 10, there is a definite need for treatment. A total score combining the dental health component and the aesthetic component can be given to define the treatment need. So in order to define the IOTN, we should have the score of both components. IOTN has its limitation when it's applied to the mixed dentition patient, and the aesthetic component can be considered as subjective assessment. However, dental health component of the IOTN provides a structured method for assessment of malocclusion. So this part of the index can be considered as a subjective part when compared to the dental health component. Now we finish the treatment need indices with its example of the index of orthodontic treatment need, or the IOTN. Treatment outcome indices. Here we have two main examples: peer assessment rating, or PAR index, which is a British index, and the CAST radiograph evaluation, which is an American index. PAR index. This index can be used pre-treatment and post-treatment. It's also used on a study model with a specially designed ruler. If we score the pre-treatment model, we can get the degree of malocclusion. But if we score pre-treatment and post-treatment and compare the results, we can get the degree of improvement, which is the difference between the post score to the pre-treatment score. PAR score has 5 components: anterior crowding, buccal occlusion, overjet, overbite, and center lines. You can see that each component is multiplied by a number which represents the weight for this component. For example, overjet is multiplied by 6. That means according to this index, overjet is the most important component, followed by the center lines. As I mentioned earlier, the difference between pre-treatment PAR score and the post-treatment PAR score representing the degree of improvement of the case. So if the power reduction was less than 30%, that means the case was worse or there is no better change according to treatment. If the power reduction was greater than 30%, that means we have an improvement in the case according to the treatment. If the power reduction was greater than 70%, we have a high standard of treatment, and if the power reduction was 22 points or greater, that means we have a great improvement in the case due to treatment. For example, if the pre-treatment power score was 50 points and the post-treatment power score was 10, that means we have a reduction of 40 points, and according to this scale, 40 points means great improvement in the case. One of the limitations of the power score if we started with a low pre-treatment power score, because, for example, if we started with a pre-treatment power score of 20, even if the treatment was excellent, we cannot get a high reduction in the scores. Also, we have other different limitations for this index. For example, it doesn't account for the facial profile, tooth inclination, arch width, and spacing between posterior teeth. Also, it cannot be applied for patients with mixed dentition. The second outcome index is the CAS radiograph evaluation, which was developed to assess the cases for those applied for the American Board of Orthodontics. It has 8 components: alignment and rotation, marginal ridges, occlusal contacts, buccolingual inclination, occlusal relationships, overjet, interproximal contacts, and root angulation from an OPG radiograph. This index composed of more criteria compared to the PAR index, therefore it can be considered more precise and objective when compared to that index. Each one of these components is scored from 0 to 2, and the total of these scores representing the total score for the CAS radiograph evaluation index. The advantage of this index is that it depends only on the post-treatment study model, so there is no need for the pre-treatment study model. When we get the total score for the CAS radiograph evaluation, which represents the sum of the scores of each of the 8 components of this index, we can categorize the result into 3 categories. Either we have a total score of greater than 30 points, or between 20 to 30 points, or less than 20 points. If the total score was greater than 30 points, that means the treatment was unacceptable, because we still have scores from these 8 components that increase the total amount of score. If the total score between 20 and 30 points, the treatment needs re-evaluation or it can be considered as incomplete treatment. If the total score was less than 20 points, that means we have a satisfactory treatment. Now we finished treatment outcome indices, the PAR index and the CAS radiograph evaluation index. And finally, we have multipurpose orthodontic indices with an example of the index of complexity, outcome, and need icon. From its name, this index is used to assess the complexity of the case and evaluate the outcome and the need for treatment. It has 5 components. One of these is the aesthetic component of the IOTN, crossbite, upper arch crowding and spacing, buccal segment anterior-posterior relationships, and anterior vertical relationship. These are the 5 components of the index of complexity, outcome, and need. You can see the aesthetic component of the IOTN is the most important factor because it has a weight of 7, which is the highest compared to the other components. Just a note that the IOTN and the PAR indices are widely used in the UK, while the American Board of Orthodontics Discrepancy Index and the cast radiograph evaluation is widely used in the USA. Finally, this is a review of these indices that we took in this lecture: diagnostic indices, treatment complexity indices, treatment need indices, treatment outcome indices, and multipurpose orthodontic indices. I hope this lecture was beneficial to you. Thank you for your attention and best wishes.